A quick video on my cataract surgery, mainly because when I was trying to find out about other people doing it, a lot of the videos, like when they're done from a doctor's office or by a doctor's office, I don't know, just I'm always a little suspect or paranoid. When I'm trying to make a big decision, I love to find videos of what seem like real people given kind of their experience and their thoughts, so that's what I thought I'd do. So I did cataract surgery this morning. I'm about 3.5 hours or so post-op. So one of the big decisions when you go to get cataract surgery is they're going to offer you upgraded lenses, kind of like prescription lenses versus kind of the regular ones. With the regular lenses, it'll get your vision clear, but you'll need to wear glasses. And the cost difference, I did it at a place in Central Florida in Lake Mary. The cost difference was about $2,000 an eye. I think I spent about $3,000 an eye total to get the upgraded eyes and upgraded lenses and that kind of thing. To me, it's a no-brainer. My mom didn't want to spend the money, and I talked to another gentleman when I was in the waiting room, and it's your eyes, and for the rest of your life to potentially not need glasses seems like something that you would figure out a way to get done if you're going to do it. So I did what they call the Monovision right now. So I did my right eye about 3 years ago, had cataract at 47. I'm not even 50 yet. I'm really young for that. Probably some genetic things there. And I had that eye set for near, so I've never needed glasses since then. Truthfully, the first couple weeks after I got the right eye done, I did have a lot of headache issues with my eye, with my brain adjusting to an eye set for a certain distance. Now I don't, that's 3 years ago. I don't recognize it anymore, or even realize that my eye's set that way. Now if I cover my left eye and just look out my right eye, it's blurry, meaning because anything far away is blurry. It's set for a certain range. And in the meantime, my left eye would do distance, but over the last year, started getting blurry. I went actually to get LASIK, and it turned out it was another cataract. So I got my surgery done this morning. So the procedure itself, basically you go in, they give you some Valium, at least it in my case, they calm you down, it's 10 milligrams. And then the procedure itself, there's a lot of prep, but the actual procedure was probably less than 10 minutes. No pain, feel some pressure. It's a little nerve-wracking because they're working on your eye and you can feel it. You kind of look around and follow this light. Excuse me. And they do everything there. You don't really know exactly what's going on. It's lots of drops and things like that. You just basically focus on this light. And like I said, the procedure was about 10 minutes. No major pain. You can see now, I don't know if you can tell, it's a little blood stain, maybe a little blurry, but like I said, about 3.5 hours. I have drops I have to put in every couple hours. Already though, I was sitting out back, I could see distance for the first time. I'm watching TV, kind of taking it easy today. I can watch TV without glasses, which I haven't been able to do for a while. So definitely the Monovision is the way to go. On my right eye, in full disclosure, I did get a detached retina when I did that about a month later, which I'm sure was related, and that was very invasive and a pain, so I'm really hoping that doesn't happen on my left eye. I know it's a potential side effect, so I'll pay close attention to that. But as far as the procedure itself, a no-brainer. If you're considering doing cataract surgery, I would say do it. Done 2 eyes now, same place, very little problems. Detached retina was a problem, so that is the risk that you're taking. But they were able to reattach that and have had no problems since. And it's really great not having to ever wear glasses. I can read. I can see the tiniest little numbers on things that I used to not even be able to see with my glasses. So hoping my left eye has the same result as my right, other than the detached retina part. I'll probably do another video, maybe a few days, just to kind of do an update. But if you're considering doing cataract surgery, one, do the Monovision, or if you're just doing one eye, then get the eye set for near, and then down the road you can get your other eye set for far if you need to do that. But definitely pay the extra money. I think it's about $2,000 upgrade if you can. No pain. A lot of anxiety before you do the surgery, but the surgery itself is fairly pain-free. So, like I said, maybe I'll do an update on another one, but I wanted to give you my thoughts on my cataract surgery. Today is, we're in November of 2018. All right, that's my report. Bye-bye.